to transfer you from out of bed into the chair. Okay, the actual skill is transferring the resident from the bed to the wheelchair. Okay, but because we can't use real people, make sure that's all the way down. We're doing this on a mannequin, so we're limited as to what we can actually do. All right, for this skill, you're gonna make sure the brake is on first. Okay, because we're moving her. We're also not going to raise the bed to a good working level because in reality, we want her feet to be able to touch the floor so she can get up. All right, so, hold on. So what I'm gonna do is I am gonna move the bed up to my working level for just a minute, because I'm gonna scoot her closer to the edge of the bed. So whether or not you do it in 3 sections is up to you. She has clothes on, so we're going to, she doesn't need to be covered. All right, so we just make sure she's close to the edge of the bed. Oh. All right, now I'm gonna lower it back down. Because like we talked about, you always have to keep your safety in mind also. And this may just be like a 30-pound mannequin, but. Alright. So we want to use the bed and make the bed do the majority of the work. Okay, so we're going to get her close to a 90-degree, if you want to get up and come around. Okay, as close to a 90-degree position, that way we're not having to lift her up as well as twist her around, okay? So what we're gonna do is we'll put on the gait belt. How you doing today? This is why we don't do it on a real person, because I would be really in your face right now. Okay, and so you want to make sure it's tight, okay? You can fit a couple of fingers under there, but not too many, okay? All right, and then what you're going to want to do is you're going to let her dangle, okay? So we're going to go across the top of the knees and behind her neck and just go like this. Come on, Martha, let's cooperate. Okay, and so, because it's a mannequin and they don't cooperate, I'm going to stick a pillow right there. All right, and then you're going to check again, because for a real person, when you change positions, the belt loosens up. Okay, so you're going to check while they're dangling. We're letting them dangle to let their blood pressure equalize. You know, sometimes you stand up too much and you too fast and you get a little dizzy. Well, we're going to let them adjust. Okay, we're going to ask them if they're dizzy. And then you're going to prepare to transfer. So transferring always underhand, because these muscles are stronger than these muscles. So we're going to lift. So we're not really, but we're going to say, okay, on the count of 3, I'm going to lift, I want you to push off. That's how you would do it with a real person, okay? So 1, 2, 3, and then you would lift, okay? And so that's the skill. All right? If it were a real person, let's see if I can actually do this. If it were a real person, you would lift, pivot, sit.
Their legs don't stay into the middle of your feet?
Huh?
When you,
Well, yeah, they do, but it's a mannequin.
okay, I just wanna make sure. Okay.
Yeah, the best way for, when you're having somebody stand up, is if you put your feet, if you put the resident's feet in between your feet, or at least 1 foot toe to toe, so that they can't slide anywhere. Okay? Alright, so that actually looks good. So we'll just practice this skill like this, we'll just put her in the chair, okay? Any questions?